Welcome to the National Council Licensure Examination, NCLEX-RN. These 860 questions will help you prepare for the NCLEX-RN examination. The questions are based on the categories that are included in the exam. They are similar and often identical to the actual questions that you will be asked. Each question has been researched and the answer verified. Question 321. Client has been admitted to the nursing unit with a diagnosis of severe anemia. She is slightly short of breath, has episodes of dizziness, and complains her heart sometimes feels like it will beat out of her chest. The physician has ordered her to receive 2 U of packed red blood cells. The most important nursing action to be taken is A. Starting an 18-gauge IV infusion. B. Having the consent form of the child. C. Administering the correct blood product to the correct client. D. Transfusing of blood in a 2-hour time frame. Answer C. Explanation. A. An 18-gauge IV is an appropriate size for administering blood. However, client safety demands that the right blood product must be administered. B. The consent form is legally necessary to be on the chart, but client safety is maintained by giving the correct blood component to the correct client. C. Administering the correct blood product to the correct client will maintain physiological safety and minimize transfusion reactions. D. The blood administration should take place over the ordered time frame designated by the physician. Question 322. Client has been diagnosed with congestive heart failure. His fluid intake and output are strictly regulated. For lunch, he drank 8 ounces of milk, 4 ounces of tea, and 6 ounces of coffee. His intake would be recorded as A. 500 millimeters, B. 540 millimeters, C. 600 millimeters, D. 6 and 55 millimeters. Answer B. Explanation. ACD, this answer is a miscalculation. B. 1 ounce equals 30 millimeters, therefore 18 ounces. Question 323. A 40-year-old client is admitted to the coronary care unit with chest pain and shortness of breath. The physician diagnosed an anterior wall myocardial infarction. What test should the nurse anticipate? A. Reticulocyte count, creatinine phosphokinase, CPK. B. Aspartate transaminase, alanine transaminase. C. Sedimentation rate, WBC count. D. Lactic dehydrogenase, CPK. Answer D. Explanation. A. Reticulocyte count measures the number of immature erythrocytes. CPK is an enzyme released from injured myocardial tissue. B. Aspartate transaminase is an enzyme released from injured myocardial tissue. Alanine transaminase is an enzyme released for general tissue destruction, which is specific for a liver injury. C. Sedimentation rate is a non-specific test for inflammation. D. Lactic dehydrogenase and CPK enzymes released from injured myocardial tissue. Question 324. A 60-year-old woman exhibits forgetfulness, emotional lability, confusion, and decreased concentration. She has been unable to perform activities of daily living without assistance. After thorough medical evaluation, a diagnosis of Alzheimer's disease was made. An appropriate nursing intervention to decrease the anxiety of this client will include A. Allowing the client to perform activities of daily living as much as possible unassisted. B. Confronting confabulations. C. Reality testing. D. Providing a highly stimulating environment. Answer A. Explanation. A. This answer is correct. The more client is able to control her daily routine, the less anxiety she will experience. B. Confrontation tends to increase anxiety. C. Reality testing is an assessment tool. It does not decrease anxiety. D. A highly stimulating environment increases distractibility and anxiety. Question 325. A 25-year-old outpatient presents with a diagnosis of compulsive personality disorder. His co-workers become annoyed with his rigid, perfectionist manner and preoccupation with trivial details and schedules. A nursing intervention appropriate for this client would conclude A. Encouraging him to engage in recreational activities. B. Avoiding discussion of his annoying behavior. C. Encouraging the client to set a time schedule and deadlines for himself. D. Contracting with him for the amount of time he will spend on the compulsive behaviors. Answer D. Explanation. A. The client will work hard at the activity instead of enjoying it. B. The nurse should allow the client to discuss these thoughts within limits, not to avoid discussing them. C. The compulsive client tends to control time to excess. It should not be encouraged. D. A contract with the client regarding the amount of time that will be spent discussing the compulsive activities is appropriate. Time allotted should be gradually decreased. Question 326. A client has returned to the unit from the recovery room after having a thyroidectomy. The nurse knows that a major complication after thyroidectomy is A. Respiratory obstruction, B. Hypercalcemia, C. Fistula formation, D. Mesenchyma. Answer A. Explanation. A. Respiratory obstruction due to edema of the glottis, bilateral laryngeal nerve damage, or cachial compression from hemorrhage is a major complication after thyroidectomy. B. Hypercalcemia accompanied by tetany from accidental removal of one or more parathyroid glands is a major complication, not hypercalcemia. C. Fistula formation is not a major complication associated with thyroidectomy. It is a major complication with a laryngectomy. D. Mesenchyma is hypothyroidism that occurs in the downs and is not a complication of a thyroidectomy. A thyroidectomy client tends to develop thyrostorm, which is excess production of thyroid hormone. Question 327. The nurse documents the client's surgical incision as having red granulated tissue. This indicates that the wound is A. Infected, B. Not healing, C. Necrotic, D. Healing. Answer D. Explanation. A. The wound is not infected. An infected wound would contain pus, debris, and exudate. B. The wound is healing properly. C. A necrotic wound would appear black or brown. D. The wound is healing properly and is filled with red granulated tissue and fragile capillaries. Question 328. A 27-year-old Brimi gravida at 32 weeks gestation has been diagnosed with complete placenta previa. Conservative management, including bed rest, is the proper medical management. The goal for fetal survival is based on fetal lung maturity. The test used to determine fetal lung maturity is A. D-nitrophenylhydrazine, B. metachromatic stain, C. Blood serum phenylalanine test, D. lecithin spring glomalin ratio. Answer D. Explanation. A. Dinitrophenylhydrazine is a laboratory test used to detect phenylketonuria, maple syrup urine disease, and Lower syndrome. B. Metachromatic stain is a laboratory test that may be used to diagnose Tay-Sachs and other lipid diseases of the central nervous system. C. The blood serum phenylalanine Test is diagnostic of phenylketonuria and can be used for wide-scale screening. D. A lecithin spring gall-myelin ratio at least 2:1 is indicative of fetal lung maturity, and survival of the fetus is likely. Question 329. A client has begun to exhibit signs of alcohol withdrawal. The blood pressure has risen from 120/60 to 190/100. Pulse is increased from 88 to 110, and she is irritable and agitated and has gross motor tremors and hands. The nurse notifies the doctor. The nurse can anticipate that the doctor will order which the following: A. An opiate such as propoxyphene napsylate Davocet. B. A benzodiazepine such as chlordiazepine Librium. C. A tricyclic antidepressant such as amitriptyline Elavil. D. A phenothiazine such as chlorpromazine Thorazine. Answer B. Explanation. A. Benzodiazepines are drugs of choice for alcohol withdrawal. B. The drug has a sedative effect, is safe, and has an anticonvulsant effect. C. Amitriptyline is an antidepressant. D. Chlorpromazine is most effective in psychotic disorders. Question 330. A 32-year-old mother of two was brought to the hospital by her husband. He reported that his wife could no longer manage the house and children. She does not sleep and talks day and night. She has purchased some very expensive clothes. The nurse noted that client speaks rapidly and changes the subject irrationally. This is an example of A. Flight of ideas, B. Delusions, C. Hallucinations, D. Echolalia. Answer A. Explanation. A. Rapidly moving from one topic to another without following any logical sequence is called flight of ideas. B. False beliefs are delusions. C. False sensory perceptions are hallucinations, hearing voices. D. Repeating words is called echolalia. Thank you for watching.